Miss breast cancer awareness brochure. Oh, thank you. What is this? What is this? Is this a lump? Ah, it hurts. Oh God, oh God, oh God, oh God.
Did you know that the prediction for the number of people to develop breast cancer in 2022 is over 200,000 people? We are here to discuss one of the most prevalent cancers in the Inland Empire, breast cancer. We would like to emphasize a quick disclaimer before beginning this presentation. The upcoming information is not intended to be a substitute for medical advice, diagnosis, or treatment. Please consult with your physician regarding any and all medical concerns. Never disregard or delay medical advice or treatment because of something you learned through this presentation. The main objectives we have for you is to understand what breast cancer is, identifying risk factors associated with breast cancer, and how to prevent breast cancer from occurring. It is also important to know what resources are available near you in the Riverside and San Bernardino counties. Breast cancer begins in the connective and fatty tissues in which the cells divide uncontrollably and rapidly. This causes the cells to divide out of control, leading to the formation of a tumor that may develop into cancer. The prevalence for breast cancer is actually related to your ethnic background, as the populations who identify as white and Black are more prone to get breast cancer in their lifetimes, followed by Asians and the rest of the other ethnic groups. Every 1 in 8 women develop breast cancer, which is 13% of the population. For men, every 1 in 833 develop breast cancer. With this population, there is a much higher risk for women compared to men to develop breast cancer. There is a misconception that men can't contract breast cancer, but they can. The risk is just very low. Breast cancer can be a very taxing illness on its patients. Due to the extensive treatment, many women experience fatigue, insomnia, cognitive disturbances such as changes in memory, and depression. It is important to consult with a licensed physician, especially since these behavioral factors can be long-term and may continue even after cancer treatment. As mentioned before, even though it's a very small risk, men can still get breast cancer. However, being a woman automatically increases the risk. Also, a family history of containing the breast cancer genetic mutation gene does not guarantee one will develop the disease. However, it does make them more susceptible to it. When it comes to age, the older a person is, the more likely they are to get breast cancer. Consuming alcohol and being overweight after menopause are also known to increase the overall risk. Lastly, radiation treatment, especially in the chest area, done at a younger age to fight other forms of cancer, can contribute to the likelihood of one getting breast cancer. Some of the symptoms breast cancer patients may experience are lumps in or around the breast area, pain, changes in texture of the breast, discharge, nipple inversion, lymph nodes, dimpling, and redness, as well as swelling of the area. Although it is always recommended to speak with your doctor, checking your own breasts regularly can help identify early signs of the cancer or any unnatural masses. A breast self-examination is a simple way of checking to make sure your breasts are healthy. There are quite a few different ways to conduct a self-examination. One can choose to examine their breast visually, bare-chested in front of a mirror, and search for any of the physical symptoms stated earlier, or one could also use their hands and fingers to apply pressure to the breast tissue around the chest and ribs to look for hard lumps or knots near the underarm. In order to be diagnosed with breast cancer, a physician typically has their patient undergo an MRI, a breast ultrasound, and/or a diagnostic mammogram to scan the tissue of the breast to search for any abnormal growths. When left untreated, breast cancer will progress. As this disease is not one that can go away on its own, it is important to seek medical advice and/or treatment to avoid this. Here is a closer look into how this progression occurs. Stage 0 uses a term in situ, which means in the place of origin or the place where it began, and details how the cancer has started but has not yet spread from this area. Similarly, in stage 1, the cancer can still be found in this general area but has now broken free and can attack the surrounding healthy tissues. Stage 2 is when the cancer gets a bit more difficult, as there are different levels of severity in the way it grows and spreads. Stage 3 is considered to be an advanced form of the cancer and is more difficult to fight due to the extent it has gone. Lastly, stage 4 is when a term, metastatic, is used to describe how the cancer has invaded vital organs and is considered deadly because it is nearly impossible to rid the body of the cancer in all areas it has traveled. The American Society of Clinical Oncology states that there are many types of treatment for breast cancer. One of the most common treatments is surgery, which is the removal of the tumor and surrounding healthy tissue. The two types of surgery are lumpectomy and mastectomy. A lumpectomy is the removal of the tumor and some surrounding healthy tissue. Most of the breast is still there. A mastectomy is the complete removal of the entire breast. The size of the tumor and remaining breast tissue will determine whether a patient will need to undergo a second surgery. Following surgery, other therapies are recommended to destroy leftover cancer cells. Radiation therapy uses high-energy X-rays to destroy cancer cells. External beam radiation therapy, which is a machine administered outside the body, is the most common form of radiation therapy. Chemotherapy is also an option. It is the use of drugs to destroy cancer cells and to keep the cells from growing and mutating. Chemotherapy can be used before surgery to make a large tumor smaller, or after surgery to lower the risk of recurrence. Another treatment is hormonal therapy that blocks hormones from attaching to receptors on cancer cells. Hormonal therapy is also known as endocrine therapy. The endocrine system is the hormone producer of the body, therefore, hormonal therapy blocks or decreases hormone levels in the body to help reduce recurrence. Lastly, biological therapy uses the body's immune system to attack cells. It is used to prevent tumor growth and spreading of the tumor. Now, how can we lower the risk of breast cancer? According to the Mayo Clinic, one of the best ways is getting an annual mammogram, which is a low-energy X-ray screening of the breast. Do not shy away. Be vigilant about checking for any changes in your breasts. Maintaining a healthy diet and weight by eating fruits, vegetables, grains, protein, etc. can lower your risk of breast cancer and other types of cancer. Reducing your calorie intake and squeezing in at least 150 minutes of exercise per week will aid in lowering this risk. Limit your alcohol intake because, according to research, even small amounts can increase the risk of breast cancer. Individuals should avoid smoking, as it can also increase the risk. Breastfeeding has also been shown to help. Studies show that breastfeeding helps shed breast tissue, which in turn helps potentially remove cells with DNA damage. Lastly, combination of hormone therapy increases your risk of breast cancer, so please consult with your physician about the risks and have them monitor you when taking hormonal medication. Here we have a few resources for you in the Riverside and San Bernardino counties. These are Breast Cancer Solutions, which helps give financial assistance to breast cancer patients. This is similar to the Every Woman Counts program, which also has a 24/7 number you can reach them at for information regarding breast cancer. These two resources also help connect you to other resources around the Riverside and San Bernardino counties. Next, we have Pink Ribbon Place, located in the Riverside County, which helps with providing supplies for people with breast cancer. Lastly, we have a self-breast examination tutorial video, which can help you learn about how to care for your breasts. In the concluding slides, we'd like you to meet the team who were able to contribute to this presentation. We have Alicia Nguyen, a sophomore at UCR, Charitha Gadella, a senior at UCR, Ola Ayesh, attending Norco College for her post-bac, Jasmine Garcia, a sophomore at UCR, Lizeth Tinoco, a senior at UCR, and finally, Maya Bello, an incoming transfer student and soon-to-be senior at UCR. We would like to give credit to all of our lovely team members who were previously mentioned for their contributions to this video presentation. We would also like to acknowledge and give credit to Esmeralda Trejo, George Gu, Emery Lohr, and Nisha Cambo for helping with the creative process. This concludes our presentation on breast cancer. Thank you for listening, and we hope this information allows you to live your breast life.